Hi, I'm Dr. Hamid Jalilian. I'm a professor of otology and neurotology at the University of California, Irvine, and chief medical advisor at Neuromed Clinic. Today, I'd like to talk about reactive tinnitus. Have you ever noticed that your tinnitus gets louder after everyday sounds? For instance, sounds like running water, noise from a fan, driving in a car, or even being out in public? If so, you may be dealing with a specific subtype of tinnitus called reactive tinnitus. You can find a much more detailed article on this topic on our website, but today I want to introduce some of the key concepts that are important to understand, because reactive tinnitus is often misunderstood, misdiagnosed, and treated incorrectly. So let's start with what reactive tinnitus actually is. Reactive tinnitus is a type of tinnitus where sound exposure causes the tinnitus itself to increase in volume, in intensity, or in intrusiveness. A sound may not bother you while you're hearing it, but afterward, your tinnitus spikes, becomes louder and more bothersome. For some people, the reaction is immediate. For others, sound exposure accumulates throughout the day and their tinnitus gradually gets worse. And for some people, a brief sound exposure can cause a spike that lasts for hours or even days. When patients describe these patterns, it tells me we're not dealing with a simple hearing problem. We're dealing with a nervous system that has become overly reactive, a medical problem in the brain that is actually treatable. The traditional view of tinnitus focuses primarily on the ear, but reactive tinnitus behaves differently. The sounds that trigger it are often not loud sounds at all. They are everyday sounds that most people would consider harmless. That tells us the problem isn't the sound itself. The problem is how the brain is processing that sound. What we often see is a phenomenon called central sensitization. The brain becomes increasingly reactive to sensory input. Instead of adapting to repeated sound exposure, the system becomes more sensitive over time. Patients often describe this as a winding effect. The more sound they encounter throughout the day, the worse their tinnitus becomes. This is very similar to what we see in migraine disorders, chronic pain conditions, and other neurological hypersensitivity syndromes. The brain essentially becomes stuck in an amplified state, causing ordinary sound exposure to produce an exaggerated response. This is where many patients get frustrated. The standard recommendation for tinnitus is often sound therapy. And for many types of tinnitus, sound therapy can be very helpful. But reactive tinnitus is different. If the nervous system is already unstable and hypersensitive, introducing more sound too early can actually worsen symptoms. Patients are often told they need more sound exposure when their brain is not yet ready to tolerate it. As a result, their tinnitus becomes more reactive, their anxiety increases, and they begin avoiding more and more situations. The issue isn't that sound therapy is wrong. The issue is timing. Before we focus on sound rehabilitation, we first need to stabilize the neurological process that's driving the reactivity. One of the most important concepts to understand is that reactive tinnitus often behaves very much like migraine. When most people hear the word migraine, they think of headaches. But migraine is actually a disorder of sensory processing. Many patients with reactive tinnitus also report sensitivity to sound, motion, stress, sleep disruption, weather changes, and other sensory triggers. We believe many cases of reactive tinnitus represent a migraine spectrum disorder affecting the auditory system. This model explains many of the features we see clinically, including sound sensitivity, symptom instability, delayed reactions, and prolonged spikes. When we view reactive tinnitus through this neurological lens, many things that previously seemed confusing begin to make sense. And most importantly, it opens the door to treatment strategies that address the underlying cause. At Neuromed Clinic, our first goal is not sound therapy, not counseling, not coping better. Our first goal is stabilization. We focus on reducing the neurological hypersensitivity that's driving the reactivity. That may involve medical treatment, targeted supplements, sleep optimization, dietary changes, stress reduction strategies, and other interventions designed to calm an overactive nervous system. Once the system becomes more stable, we can gradually begin rebuilding sound tolerance. At that point, carefully structured sound exposure can become extremely effective. The key is sequencing. Treat the instability first, and only then begin to rebuild tolerance. If you think you may have reactive tinnitus, I encourage you to read the full article on our website. You may also want to take our tinnitus severity assessment, because understanding the pattern is often the first step toward getting the right treatment.